Hello, I'm Dr. Jong-Yun Park, a plastic surgeon at Soonplus Plastic Surgery Clinic. Today, I'd like to talk about the differences between two facelift techniques, deep plane facelift and dual plane facelift. One of the most common questions from patients considering a facelift is about the surgical technique itself. Since the terms deep plane and dual plane sound quite similar, many people find them confusing. Before discussing the differences between these two techniques, let's first review the basic principles of facelift surgery. As we age, facial sagging occurs, not simply because the skin becomes loose, but because the underlying SMAS layer, facial fat, and supporting ligament structures gradually descend over time. In advanced facelifting procedures such as facelift, the goal is not merely to tighten the skin. Instead, the quality of the result largely depends on how precisely the surgeon addresses the SMAS layer, the deeper fascia layer beneath the skin. Firstly, let's start by looking at the deep plane facelift. For the deep plane facelift, the skin and SMAS layers are elevated together as a single unit. By releasing the facial retaining ligaments, the deeper facial tissues can be repositioned as one cohesive layer. This technique often provides a more natural lift of the nasolabial folds, cheeks, and mid-face, and is known for its long-lasting results. However, deep plane facelift is a highly advanced procedure because it involves working within deeper anatomical planes. The surgeon's expertise and experience of facial anatomy are critically important. Now, let's take a look at another facelift technique, the dual plane facelift. For the dual plane facelift, the skin layer and the SMAS layer, these two layers are separate, allowing each layer to be lifted independently in different direction and in different intensity. The surgeon partially separates the skin and SMAS layer, lifting SMAS layer first and then red rapes the skin naturally over the lifted foundation. This approach allows for more precise control over the intensity of the lift. It offers greater flexibility in adjusting the lifting direction for different facial areas. At this point, some of you may wonder, which technique is better? To summarize the key difference, in a deep plane facelift, the skin and SMAS are moved together as one unit from a deeper anatomical layer. In a dual plane facelift, the skin and SMAS are separated and lifted individually. Deep plane facelift can be particularly beneficial for patients with significant mid-face descent. Dual plane facelift may be well suited for patients seeking natural-looking rejuvenation and customized lifting tailored to specific areas of the face. For this reason, there is no universally superior technique. The best facelift approach depends on multiple factors such as mid-face volume, skin thickness. After considering these factors, the ideal procedure is the one that best matches each patient's individual characteristics. And even for the same deep plane, same dual plane procedure, the results can vary depending on the surgeon's philosophy, technical approach, and level of experience. Today we've discussed about two facelift techniques, deep plane and dual plane facelift techniques. Have your questions been answered? We will come back with more helpful information soon. See you soon.